Hey everybody, it's Jasmine Polite again, and this is the second edition of All About Glaucoma. It is a series, and this time we are going to be discussing about what is glaucoma. So, if you all want to know what glaucoma is a group of eye conditions that causes the eye pressure to go up, and if that happens, optic nerve damage could be present, and that could lead to blindness. So, a common type of glaucoma that is really common is open angle glaucoma, and that one usually doesn't have any warning signs, and so glaucoma is known as the sneak deficit, which meaning people don't know they have it until it is too late, until they've lost most of their vision. It does require, you do require to get treatment right away if you find out you have glaucoma, because usually glaucoma, the vision loss starts with the peripheral vision going, and then it progresses until you can hardly see anything. So it's best that everybody on here that I'm speaking to get your eyes checked, because glaucoma could occur in anyone. It can occur in anyone, but as they say, the stereotype is only older people get glaucoma. That is true, but it can occur in anyone. Babies, toddlers, juveniles, young adults, and just anyone. So it doesn't matter what age you are. You can still get glaucoma. So just get your eyes checked. Okay. So I have a book here that I got called What Your Doctor May Not Tell You About Glaucoma, and I've been reading about glaucoma, and I learned some pretty interesting facts in here. Okay, so according to What Your Doctor May Not Tell You About Glaucoma, elevated eye pressure is a significant risk factor for glaucoma, but it doesn't mean that it will indicate that you have glaucoma. So yes, eye pressure is a risk factor for glaucoma, but it doesn't automatically mean that you have glaucoma. You have to have suboptic nerve damage in your eyes, and you have to have a loss of field vision to determine glaucoma. So if you just have high pressure, then you'll be deemed as a glaucoma suspect, meaning you will have you're suspected of glaucoma, but you don't have it yet because you don't have suboptic nerve damage, but you just have high eye pressure, and that is also called ocular hypertension. So that is a high risk for glaucoma, but it doesn't mean you have it. It's just, you just will need to be monitored to make sure it doesn't turn into glaucoma. So yeah, that may be shocking to you guys that eye pressure doesn't mean you have glaucoma. It also has to be some other things that will point to it. Okay. I also learned of the risk factors of getting glaucoma, and one of them is people over 45. They're at risk because yes, because your eyes are aging, and as your body gets older, then you break down. So your eyes are part of your body, and your eyes break down too, and it definitely increases the risk. And another risk is family history of glaucoma. So if you have a brother and sister, or mom or dad, or cousins or grandparents that have glaucoma, you're more likely to get it, or your child's more likely to get it. So please, again, get your eyes checked, because it could happen to you, because genes are very strong. So anything that is genetic, it goes for anything that's genetic, anything else besides glaucoma. Please get a checkup, okay? All right. So, another one has to do with ethnic background. So African Americans are more of an increased risk of getting glaucoma than Caucasian people, and this is 4 to 6 times. So black patients, they're more likely to get the aggressive type of glaucoma and go blind than Caucasians. So that could be very devastating for the African American groups, if they are at risk for glaucoma, if they don't get their eyes checked. So that could cause them to go blind, since their glaucoma is a little bit more aggressive than of a Caucasian. It's also more common in Hispanics so Hispanics are likely to get glaucoma too, and it's common in those races. Asians, they're at risk for angle closure glaucoma and normal tension glaucoma, and I will discuss those types of glaucoma in the next series. But right now we're just going to talk about what is glaucoma. And so another one is diabetes. People who have diabetes, they are also at risk, because they have limited blood supply to the nerves of their eyes, as well as the rest of their body. So that can be a risk factor, because you're deprived of blood to your optic nerve, which is not good. Significant eye injury. And this is what happened to me, why I got glaucoma. Because any trauma to the eye, including surgery to the eye, such as cataract surgery, retinal surgery, vitreorectomy, and corneal surgery, are one of the risk factors of likely getting glaucoma. So again, a person would have to get monitored after their surgery of their eyes, to make sure nothing happens, make sure glaucoma doesn't show up, or if it does, it can be treated. So that is another risk factor of glaucoma. So long-term cortisol or steroids, and this is really big, because so to consider with this risk factor are dosage